What is cardiac arrest? A cardiac arrest happens when a person's heart suddenly stops beating. This event stops the flow of blood to important organs throughout the body, including the brain. People who suffer a cardiac arrest stop breathing and become unconscious. A timely help and aid to a patient suffering from a SCA can save a life. Cardiopulmonary resuscitation (CPR) is an emergency life-saving technique useful in sudden cardiac arrest, in which someone's breathing or heartbeat has stopped. Immediate CPR can double or triple chances of survival after cardiac arrest. Now let's learn how we can apply the basic CPR technique for the time of emergencies. First, make sure it's safe for you to reach the person in need of help. Call up emergency helpline immediately. Check the person's response by shaking his shoulder and asking loudly, "Are you okay?" Follow the CAB sequence: compressions, airway, and breathing. To perform the steps of CPR, start by putting the person on his or her back on a firm surface. Kneel next to the person's neck and shoulders. Place the heel of one hand over the center of person's chest. Place your other hand on top of the first hand and lock the fingers. Keep your elbows straight and position your shoulders directly above your hands. Use your upper body weight, including your arms, as you push straight down on the chest, at least 2 inches but not greater than 2.4 inches. Push hard at the rate of 100 to 120 compressions per minute. That is, around 2 times every second. Do not worry about breaking the rib of a person while giving a CPR. It is more important to save a life. Then go on to opening the airway and rescue breathing after every 30 compressions. Put your palm on person's forehead and gently tilt the head back. Then with the other hand, gently lift the chin forward to open the airway. Pinch the nostrils shut for mouth-to-mouth breathing and cover the person's mouth with yours, making a seal. Give the first rescue breath, lasting 1 second, and see if the chest rises. If it does rise, give the second breath. If the chest doesn't rise, give the head tilt and chin lift maneuver and then give the second breath. "30 chest compressions followed by 2 rescue breaths is considered one cycle. Be careful not to provide too many breaths or to breathe with too much force. Resume chest compressions to restore circulation. If you're not comfortable with this breathing procedure, you can continue compressing. Go on giving CPR until there are signs of movement or emergency medical personnel arrives and takes over. Never leave the patient alone when the symptoms of SCA start appearing. Remember all the steps correctly. Your timely help can save a life. Step 1. Call emergency helpline for medical support. Step 2. Check for person's response. Step 3. Start performing chest compression. And Step 4. Give 2 rescue breaths after every 30 compressions or continue compressing until medical help arrives.